thank you. Welcome and thank you everyone for coming to this month's webinar. And this is a very special one for us because we are launching our new project, Global Talent, Local Impact, Retaining Excellence, Developing Leaders and Learning from the Internationally Educated Nurses and Midwives Workforce. I've just looked at some of the names coming through. I know some of you, but my name is Raluca.
I'm sorry,
Oaten.
Raluca. Raluca, someone's put in the chat that they're hearing a lot of echo.
Are they? So I can't hear any echo. Is there anyone else with that issue?
I don't hear an echo either.
So either mute, go out and come back in, perhaps.
People are saying they can hear fine, so I think it might just be a local issue for that participant. Yeah, okay. People are confirming that they don't hear that echo. So great. So sorry, proceed, Raluca. hopefully that issue can get sorted out for that person.
Brilliant. Thank you very much. My name is Raluca Oaten. I'm a Research and Policy Fellow at Florence Nightingale Foundation, and I'm really delighted to welcome those who are attending live today with us, but also those who are watching this as a recording. And just as a quick reminder, all of our webinars are available as recordings for all of our FNF member organizations, our alumni and our current scholars via the portal. And my colleague Poe will put more information in the chat. But if you have got any questions about how to access, drop us an email. You'll have the email address at the end of this session. But before we commence, we thought it would be useful to have a quick reminder of netiquette. We encourage you to keep your cameras on whenever possible, especially during the question and answer section. Please do mute your microphone when you're not talking. Sometimes we have got that echo that can sort of be heard by everyone. So if you're not talking, please do mute your microphone. We do encourage you to use the chat function for questions, for comments, and as I mentioned, there will also be a question and answer section. Please do raise your hand if you have any questions or comments. And finally, I am guilty of this, but please try and stay, if possible, stay present and avoid that multitasking that I'm sure all of us have to do from time to time. In today's webinar, we'll be giving you a little bit of a background about why this project, why now, and why FNF. We'll then delve into the project's aims, objectives, methodology, timescales. And as previously mentioned, there will be a question and answer section, and we will be addressing some of the questions that you very helpfully, and thank you very much for sending. Some of you sent those questions in advance via Eventbrite, so we'll be looking at those, but also open to you as a live audience for more questions. And lastly, we'll talk about how you can get involved and what are the next steps. And without any further ado, I welcome Dr. Lisa Plotkin, the Head of Policy and Influence at FNF, to talk to you about this project, to talk about why this project, why now, and why FNF.
Thank you so much, Raluca. And hi, everyone. It is a real pleasure to be here today to set the wider context for this project and why we're doing this at this moment in time. So next slide. But before jumping in, I want to say a word about terminology. So there is no single agreed term for nurses and midwives who've moved here from another country to practice. Depending on the context, people use terms I'm sure you've all heard, like internationally educated, internationally trained, or overseas recruited. And each carries slightly different connotations depending on audience and policy focus. But for this project, we are using the term internationally educated nurses and midwives, abbreviated as IENMs, defined as NMC registrants who obtained their initial nursing or midwifery qualification outside of the UK. So this applies even if they've then since studied or qualified further here. And I think it's also really important to mention that IENMs are distinct from colleagues in the global majority, Black and minority ethnic, or diaspora communities, although there is significant overlap. But we think it's really important to stress that not all IENMs identify as part of these groups, but where they do, we also recognize that those experiences can intersect and challenges may compound. So, for example, if you can't get promoted because your international qualification is not recognized here, that disadvantage can combine with those arising from underrepresentation, creating additional layers of disadvantage and complexity. So we think recognizing this distinction is vital. It will ensure that the specific challenges faced by IENMs are acknowledged in their own right, while still understanding where their experiences overlap with those of global majority, diaspora, and BME colleagues. Next slide. So why this project and why now? Well, for decades, the UK has benefited from the knowledge, skill, and compassion of IENMs. From the Windrush generation onwards, international recruitment has shaped the very fabric of our health and care system. And during the pandemic and in the difficult immediate years that followed, their presence quite literally kept services running. And today, that contribution has grown to extraordinary levels, and especially so over the last 5 years on the slide. Now, almost one NMC register, around 24%, were educated outside of the UK. So next slide. But the impact of international recruitment has been about far more than just numbers. It has undoubtedly enriched our professions, bringing new perspectives, cultural understanding, and deeper connections to a global community of practice. Through diaspora networks, mentoring, and partnerships, IENMs have shared expertise, supported colleagues, and built enduring professional bridges between the UK and their countries of origin. This is a story of mutual benefit, a global exchange that strengthens care here while fostering professional growth and capacity abroad. And while we know that sustainable workforce planning must focus on recruiting, training, and retaining more nurses and midwives domestically, we think that that ambition must sit alongside a commitment to valuing and investing in the international professionals who are already a part of our workforce. We don't think it's an either or. We think the two go hand in hand. Next slide, please. Yet this success is now under strain. In the 12 months to March 2025, more than 5,200 IENMs left the NMC register. That's a 33% increase on the previous year. And more concerning, as you can see on the slide, the percentage leaver rate has also accelerated sharply in 2025 and now stands at 2.7%. Next slide. And some of you might be thinking, so what? 7% leaver rate is pretty good if you know a lot about workforce planning, and you would be right. A 2.7% leaver rate is one to envy. But when comparing overall leaving rates, as you can see on the slide, UK educated nurses and midwives leave at 3.6% compared to just 2.7% for our IENMs. So this might suggest that retention is actually better amongst our international cohort. Next slide. But this is slightly misleading. So the UK leaver rate is driven by retirement primarily, or that natural attrition at the end of what we hope have been long and fulfilling careers. So the NMC research shows that approximately 44% of UK leavers cite retirement as their main reason for leaving. And so when we strip out people who say they've left due to retirement, which we know is self-reported, so it's not 100% accurate, but when we strip out those people, a very different picture emerges. So we see that UK educated, which is that lighter teal bar, shows a pretty stable rate over the past 3 years at a leaver rate of 2%. Whereas our internationally educated leaver rate, which is that darker teal color, has been rising steadily and rose quite sharply actually in this last year. And our IENM colleagues are now leaving at a 26% higher rate when we strip out retirement than their UK colleagues when comparing like for like. So something else is going on here. Next slide. Recent research from the Health Foundation points to another critical part of the picture about where our workforce is going when they leave. So they analyzed certificate of current professional status requests from 2022 to 2023, which nurses must submit when planning to practice abroad. And they found that 7 in 10 now come from internationally educated nurses. And most strikingly, the sharpest rise was among those who have been in the UK for less than 3 years.
Hello?
Oh, sorry, I can hear someone. If you can just mute yourself, please. Or maybe Po-Yi, you can help us mute someone. Great, thank you. So in other words, many who arrive here are leaving before they can even build a long-term career here. So just as a reminder, 24% of the register and 70% of these CCPS applications, and this analysis was from 2022, so it may be even more pronounced today. So it's pretty clear that the UK has excelled at recruitment, but we've not yet created the conditions for our IE&M colleagues to stay, thrive, and lead. Next slide. And we think we've reached a real tipping point moment. So there are a lot of challenges, but there are also opportunities. So in terms of the challenges, the first major cohort from the 50K nurses program in England are reaching the end of their initial visas. So tens of thousands of internationally educated nurses and midwives are deciding whether to renew, to move on, or to return home. And if current trends continue, we risk a significant outflow of talent, and with it, a loss of leadership potential, cultural richness, and global credibility. And at the same time, changes to immigration policy, including higher salary thresholds and restrictions on dependents, are already affecting retention and having a chilling effect. Meanwhile, reductions in international aid and global health funding threaten the partnerships that once made international recruitment ethical. As part of ethical international recruitment, we have an obligation to continue developing the nursing workforce globally, and we're afraid that we're turning away from that. And politically, this is also a moment of transition. With Scottish and Welsh elections on the horizon and the new functions of NHS England still being defined, there's a real opportunity to shape how workforce and professional policy evolves across the whole UK. And at the same time, the NMC's ongoing regulatory reforms, including its reviews of advanced practice, revalidation, and fitness to practice, will influence how IE&Ms enter, practice, and progress in the UK. So all combined, these developments create what we think is a critical window or moment for influence, a chance to help shape a coherent, forward-looking global workforce strategy, one that places our IE&Ms at the heart of the future of the health and care system rather than on the margins. Next slide. So why FNF? Why are we doing this? Well, really, it's not so much that we believe FNF as an organization is best placed to do this, but we think our FNF community, which all of you are a part of, is uniquely placed to do this project. And that's firstly because of our reach and relationships. So through our IE&M online leadership programs, we have worked directly with over 3,000 IE&Ms across the UK, and they're working in diverse settings, so in hospitals, in community, in social care, and in higher education. We've listened to their experiences, we've celebrated their successes, and we've learned where the barriers lie. And it is their stories and their insights and their ideas which are at the heart of this project. We think we are sitting on a gold mine of evidence about what works to develop this cohort. Secondly, because we focus on leadership as the driver of change. So our work is not about producing another diagnostic report that sits on a shelf. It is about equipping people with the skills, the confidence, and the networks to act on what we learn. And finally, because we bring evidence and influence together, we have already led major national reports, for example, with the NMC, translating research into actionable change, specifically with regards to this community. And it has been one of the most fulfilling parts of my role, getting to work with our IE&M alumni on making change happen, because there is so much possibility. There are so many things that are in our power to change. And it's that combination of robust evidence, lived experience, and system credibility, which gives us the leverage to ensure that the findings from this project don't just inform policy, but actually shape it. Next slide, please. And that leads me into our underlying principles and approach to this project. First, I think it's really important to say that this work, we hope, will not be additive, and it will be additive, not duplicative. We know that there's already been excellent research and advocacy in this space, driven by internationally educated nurses and midwives themselves. And we have looked at that research, from the Stay and Thrive resources to NIPEC's great work in Northern Ireland, and we do not intend to repeat it. Instead, we really want to build on what is already known, taking into account the changing profile of the register, because this is a fast-moving area, and we want to draw together all of that existing evidence, policy insight, and lived experience to identify where there are gaps, tensions, or opportunities for practical change. Secondly, we're going to be solutions focused, as I mentioned, so this is not about restating the problem. That is not what we are looking to do. We also want to be inclusive, and this means that this project will have a very wide scope, and Raluca will talk to you more about that scope, but we want to make sure that our entire workforce is included in this. So that means across the 4 nations, that means social care, that means higher education, that means smaller diaspora groups that perhaps have not had their voices and their experience represented. We also want to be adaptable. So over the course of this project, things might change. We might hear new evidence or viewpoints which direct or guide our focus. We have a wonderful steering group and an advisory group helping us along the way. And so we want to remain open to all of that feedback. We want to be collaborative. That relates to the previous one. We want to work in partnership and in dialogue. And finally, we're going to bring that FNF ethos I just mentioned, which is about centering leadership and positioning IENMs as leaders with agency when we talk about what they want and what they need. Next slide. And to do all of this, we're going to use an appreciative inquiry approach, and that's a methodology that focuses on strengths rather than deficits. Instead of starting with what's broken, we're going to begin with what works. So we're going to look at the teams, the organizations, and the leaders who are already creating inclusive, supportive environments where IENMs can thrive. And by understanding the conditions that make success possible, we can identify practical actions that others can adopt. It's a forward-looking, collaborative way of generating solutions, one that we hope will build energy, optimism, and shared ownership of change. So with that background about kind of why we're doing this, why we're doing it now, and why we think that we can lead this well, I'm going to hand over to Raluca to explain what it is actually that we're going to be doing.
Thank you very much. That was a greatly informative background, and I hope everyone has found that useful. And as you said, I will go through the aims and the scope of this work. So from an aim perspective, we have got a threefold aim, if you want. Firstly, we are really interested in understanding what makes people stay in the UK, especially in such a challenging context as obviously Lisa has presented. And we'll do that by identifying the challenges, the changes actually needed at national, system and local levels to better retain internationally educated nurses and midwives across that diverse settings, recognizing the distinct challenges and opportunities across the settings, but also across the nations. How we'll do that? Well, it will be a combination of a variety of things. We'll be using the most up-to-date data from, for example, the NMC, but also generating our own novel data set through the national survey that we're launching today. And I'll tell you a little bit more about that in a minute. The second aim is to better understand the development opportunities and also the needs of this community. We will do that by exploring what is required to support the leadership development of internationally educated nurses and midwives. How we'll do that? Lisa already mentioned, by drawing on that unique insights that we have already got from the thousands of internationally educated alumni through our leadership programs, but also by exploring the internationally educated nurses and midwives leadership pipeline and set out what works in that leadership development. And lastly, this is a really, really important aim, and I guess it's that overarching goal to learn from this workforce and this vast community. We want to make the case for a new model of global reciprocity in nursing and midwifery, showing that the UK benefits not only from the presence of internationally educated and diaspora communities, but also from sustained investment in global partnership that actually strengthen both the UK health and care and the source country systems. As mentioned, this is a really wide and overarching goal, and we aim to achieve this by exploring a variety of data currently available, such as mapping and analysing what's existing in terms of global health partnership, by also drawing on insights from internationally educated nurses and midwives and diaspora communities, but also, again, by generating that new knowledge via this national survey. By connecting this evidence and capturing the lived experience, we will set out how sustained, ethical, and mutually beneficial collaboration can strengthen the UK workforce while supporting global systems. So here's this project about. Well, again, Lisa mentioned briefly, this is a 4-nation project. What we know is that some experiences are common, they overlap, but we are very aware of the unique challenges depending on where people are working, which nation they're in. Very importantly, this is for nurses and for midwives. And whilst we often refer here to nurses and midwives as a community, we know that the challenges and opportunities at times have that distinct nuance. So just to give you an example, on the NMC register this year, it shows a steady increase in the recruitment of midwives over the last few years. So in 2022, there were 73 new internationally educated midwives. And in March of this year, so March 2025, there were 741. So very different to the picture that we see in nursing, but also with midwifery, we are also seeing that attrition that's also increasing, with 35.9% more internationally educated midwives leaving in 24-25 compared to the previous year. Lastly, and really, really importantly, we are interested to hear from nurses and midwives working across several sectors, from the NHS institutions, such as the NHS trusts, health boards, health and social care trusts, to social care, nursing homes, care homes, private providers, universities, military, voluntary sector, community. Similarly, as before, we know that each sector faces unique challenges and opportunities. Interestingly, one question that we were sent ahead was with regards to that. And I'll just give you an example with social care. We know that for social care, alongside that scarce data about actually the number of internationally educated nurses working in social care, we know that many internationally educated remain in care worker roles, sometimes because they're unable to register to achieve their PIN or to progress. Am I muting you? Sorry, I can hear some background. Or they are unable to register or progress due to barriers such as the OSCE costs, sometimes limited sponsorship, visa restrictions, or very importantly, that registration route, like the support for internationally educated for employers, which requires an NMC registered line and senior managers to sign off, which is a structure that is often absent in care settings. We plan to employ a mixed method research design, so quite a combination of different things. Lisa mentioned the desk-based research that we have already started, but also primary data collection and analysis. And if you look at it from a sort of different components, we have got 5 interlinked components to this planned research strategy. The evidence and policy review, which is a structured review of national and international literature, but very important, what we call an environmental scan. So that grey literature of workforce reports, relevant policy documents, which really will provide us with the contextual grounding across all 4 countries. We're launching the national survey. Again, I'll tell you more about it in a minute, which is a UK-wide survey. And importantly, this was designed in collaboration with this multi-sector steering group, but also subject matter experts. And some of you are on the call today, and we're very grateful for your input. We'll be having and already had various stakeholder interviews to really understand and have a context of what's happening, but also at the point where we have got the results to understand and be able to contextualize those survey findings. We're looking to book more roundtable and workshops depending on the area. So, for example, we're looking to convene strategic workshops with global partnership leads, your NHS leaders, education providers, to examine the role of that international collaboration and mutual learning in shaping future nursing practice. And we're also launching today a call for case studies. This is for all of our FNF member organisations to share your initiatives and how you support, in the retention and development processes. From a project governance perspective, as Lisa has mentioned, we have got both a steering group and an advisory group, and we're extremely grateful to both. The steering group is a group of individuals with experience, expertise of working with and supporting INMs. And importantly for us, we wanted the steering group to represent all 4 countries. So we're very intentional about that. A variety of sectors, so NHS, social care, university sectors, also nursing and also midwifery as a separate, and also the Internationally Educated Nurses and Midwives Diaspora Alliances, which are very important. As I said, this is the steering group, which will also have conversations with subject matter experts outside of the steering group. We have also got an advisory group, which we are very grateful to. And these are colleagues from the Internationally Educated Nurses and Midwives online leadership programs community, who work in a variety of settings and a variety of levels, because we need to understand how this actually applies in practice and what's the impact of this. Survey. The survey is live. So we are opening the survey today on the 23rd of October, due to close on the 28th of November 2025. And my colleague Poe will put all the links in the chat. Why are we doing a survey? Lisa said we have got a lot of information, but we also have got a lot of gaps. So we want to really understand the journey of INMs into the UK health and social care. We want to explore the support and opportunities available from those experiences. We want to identify barriers to development to be able to offer those solutions to progression and leadership. And lastly, gather those insights into what helps the retention and what creates the belonging. Who it is for? 3 groups that often overlap. So it is for internationally educated nurses and midwives themselves across the 4 countries, and also across all the sectors. It is also for diaspora community members and leaders. And the 3rd group is for those who support INM. So some of you who will take the survey will identify in all 3, some of you only in some of them. So there are 3 different groups. How long it takes to complete? We've just done it. I've just done it this morning, actually. It is between 15 to 20 minutes, depending on the level of detail. Do get a cup of tea, sit down, take your time and share this experience. They'll really, really help us get a better understanding. But we also want to say thank you. Thank you for completing the survey. And so you will see that there is a prize draw, which you can enter. This is an optional and a free prize draw. And when you enter it, you will enter your details for the prize draw separately. So none of your responses will be linked to your name or your contact details. And the prizes that we're offering in gratitude are, one is £150 voucher redeemable at a number of shops. And the second one, it is a commemoration service place. And next year, the service will take place on the 12th of May, 2026. And it is an incredible experience. If you haven't been, it's really worth looking into it. As I mentioned, we're also launching a call for case studies. And again, this is for FNF member organizations only. And you should have the link in the chat whether your organization is a member organization. The opening time is the same. You have got both the QR and you've got the link both here and hopefully in the chat. And the aim is to use that appreciative inquiry lens to really understand and showcase what FNF organizations, member organizations are doing to support INMs in their retention and development. Time to complete is similar because this is a sort of a first stop, and then we'll contact for more details. And we are asking 2 questions: to briefly describe the key initiatives and programs or approaches, and to tell us what difference has this made to your internationally educated nurses and midwives colleagues in your organization. Now, I will stop sharing so I can see you all. And I know we talked for about half an hour, so I guess now is a great opportunity to have some questions and answers section. And if that's okay, I will please do also add them in the chat, but we will have a look and bring some of those to our attention. But if it's okay with you, I will start with one of them that has been sent via Eventbrite. And the question was, What is the impact on international nurse recruitment as a result of stabilized domestic recruitment pipeline? And what advice would you give to employers for future workforce planning? And I will welcome Lisa back into the conversation to see what your reflections on that are.
Thanks, Raluca. And we've had a couple of other questions in the chat that we will come on to. I think so. I think it's a really good question when we talk about domestic recruitment. Sometimes it can be, as I mentioned, this either or. People say, well, oh, there's this focus on domestic recruitment. But what I will say is that the NHS long-term workforce plan, and this is for England only, had really sky-high ambitions for domestic recruitment numbers that many in the higher education sector doubted was possible, quite frankly, I think. And now we've learned that those ambitions are being torn up with a new long-term workforce plan, 10-year workforce plan expected sometime in the spring, which FNF is also feeding into. And so I think that, you know, the question around a stabilized domestic recruitment pathway, I'm not really sure we're there yet in terms of the increase. It's quite stable at a level that I don't think is consistent with our aspirations for workforce growth. So that's the first thing that I would say. And then I guess the second thing is just to emphasize, one of the reasons we are doing this project is we do want to emphasize that it is not an either or, it is a both and situation. And we have 24% of our register here internationally educated. And we are concerned that with policy focus being shifted, some of that investment and some of that resource is being taken away. And so with this project, we want to just move the spotlight back on to this community.
That's very interesting, and I will reflect on some of the conversations I've had with some subject matter experts. And you're absolutely right, that investment into the retention and holding on to the people that have come has shifted. So it's important to make sure that we're not losing. And I think the background that you offered was quite sobering to see what's actually happening in numbers. Before I go to another question that was sent via Eventbrite, I wonder if anyone wants to put their hand up or has any questions before we also look at the chat. So I'll give you a minute.
We've got one from Rachel here asking about, do we have multiple projects within one case study or a separate case study for each?
Just the general. So there is only one form. I think what we're interested as a first step is more of an overview, and then we'll book a further conversation to get more intelligence and more sort of details. So just the one form. We wanted to make it as easy as possible. And lovely to see you, Rachel. It's nice to see you back. Do you have your hand up? Do you have another question?
We've got one in the chat from Kerry. You mentioned stricter immigration policies, including proposed lengthening of the time to apply for indefinite leave to remain. Does the FNF plan to use this survey data to represent IAN and voices on issues such as changes to indefinite leave to remain? I think so. That's a really good question, Kerry, because FNF doesn't normally speak about these issues. So like no recourse to public funds, sort of pay and working conditions. We don't usually speak about these issues. However, it is so clear from the evidence that we've looked at, and without wishing to preempt the results of this survey, I mean, if it does come out, because we do ask about these issues in this survey, and if it does emerge, yes, we will be reporting on it, and yes, we will be speaking about it.
Thank you. And thank you, Kerry, for the question. I will turn to another question that was sent in advance. So the question says, nurses in private sector seems quite scattered in their representation to any programs or recognition. Even RCN is only focused on NHS nurses and not other nurses in private sector. How can the issue of private sector nurses be addressed? And this is something that we talked about quite a lot before we even launched this program. And this is why we are very intentional about the sector representation, but we do rely on our communities to fill in the survey, to disseminate We have got representation across our steering group of a variety of sectors, and obviously the private sector is a really important sector. We have also got representation from the private sector on the advisory group. So there's a combination. We do hope that we get a sufficient sample to be able to identify where the nuances are. And again, we rely on you as our community to share the survey. I don't know if you've got any further comments, Lisa, on this question.
Yeah, just to add that, we are, the data is really poor for what's going on in the private sector and in social care. So we are going to need a lot of help to get answers to that question. One of the people on our steering group, so Ariel, who is the chair of the International Nurses Midwives Diaspora Alliance, challenged us and said, well, how is this any different from Stay and Thrive? And I was kind of reflecting on his challenge to me. And I thought, well, Stay and Thrive isn't talking about what's going on in social care, and we looked into it, and it was really, really difficult to figure out. So we are trying to get these responses to reach this community, but that is why we need your help, because we will not be able to just reach them ourselves. We do, and FNF, we have a very expert group of social care nurses, but we do not, is not the majority of of our alumni by any means, and so we do need your help to reach this community, because that is really a great unknown. We suspect that we'll find some quite interesting and challenging things through this, in terms of waiting for registration, in terms of working conditions. And so we want to know what is going on within the social care sector, which is so reliant on our internationally educated workforce. And also, I think in terms of the private sector, a lot of this, I imagine, is going to be around what levers the NMC has to unlock things like recognition of prior qualifications, to unlock things around tests of competence. And that applies across whichever sector nurses and midwives are working in. But we do want to see if there is any support that our colleagues working in the independent sector need. So best practice. So we're really interested in case studies that we can share amongst the FNF community.
Brilliant, thank you. And I know Ariel is on the call, so thank you, and thank you for joining, and the steering group as well. Debbie, I can see you've got your hand up. Do you want to come in, and do you want to introduce yourself as well?
Yes, of course. So I'm Debbie Cubitt. I'm one of the senior clinical managers at NHS England in the east of England. And apologies, I was caught up in a meeting before, so I haven't been able to listen to the presentation, but just picking up on the chat, and hopefully it's recorded and I can watch back. But ironically, I met the lead nurse for the independent health and social care for the RCN Eastern region. So they may be a really good person, because they are covering independent health and social care, and presumably there may be one RCN representative per region. So I'll do an email of introductions, and maybe that might help, and look forward to hearing back the recording of today's presentation. Apologies, I was late.
Thank you so much, and thank you so much, Debbie, for always supporting us and the connections. Yes, the session is being recorded for those of you who joined later, and they are available on the portal as FNF members, alumni, or current scholars. You will have access to our portal. If you've got any questions, please do send us an email. But the recording is available, or will be available tomorrow. So I'll send you an email after this. I think there is a question in the chat. Guy's and St Thomas's. Yeah, go on. Do you want to?
No, I was going to say, yeah. So Liz says Guy's and St Thomas's is in the process of creating a development program for our established INMs, which will be designed post our own survey and focus groups. While there is a leadership need that has been identified, it is also career signposting and career development support. And we need to tease out what is specific to our INs versus newly qualified and UK trained nurses, as some needs are the same. Yes, and triangulating with FNF will be really useful. I mean, absolutely. I mean, one of the things that I found, so I led the NMC's review into the impact of additional advanced practice regulation on IENMs, because they're in the middle of that advanced practice review. And one of the most interesting findings from that was just the number one barrier was just a lack of information. So it wasn't actually, and that it was the same amongst the UK workforce. It was both the UK workforce and our international workforce didn't know how to access advanced practice pathways and were confused about what was required of them. So that was before you even got into anything. And then, of course, once you drill down, we found that there were issues unique to IENMs because of lack of recognition of, the masters that they might have had from their home country, or that they had to take a top-up degree in order to be able to access a master's program, or they had qualifications that, they couldn't get the equivalent status here. So yes, very interesting. That they're probably very, very interesting benchmark, Liz. So we would look forward to sharing our findings with you.
Thank you. And I was just reflecting on a piece of work done by Gemma Stacey at Nottingham Trent University around access to PhD for internationally educated nurses and midwives, which again, some of you might be involved in that work. And I know that the policy briefing is coming out shortly if it's not out already. So it's the same as the lack of information is one of the really important aspects that act as barriers as such. Najahan, who's also, thank you, on our steering group, has put a comment saying that's part of the work that they're doing at Skills for Care on the Global Majority Nursing Network. They'll also be co-designing an adaptation of the Stay and Thrive resource for social care. And that's a really, really important step forward for this work as well. Just looking to see if there's any other questions that I've missed in the chat.
I think there was a question earlier about are we reaching, I think it was healthcare support workers and also people who actually have left. And I said that there's so much, there are so many questions in the survey, actually, depending on the logic. So when you do take it, you'll know what I mean. So huge thank you in advance, because there's so many complexities. But we were thinking about, do we include people who have left, and do we try to reach them? And we made the decision that with this survey, we actually wouldn't try to reach that group, but we'd very much be interested in speaking to that group of people. So if anybody does have any connections who would be willing to speak with us, I think it would really help enrich the context of and figure out more about where they're going, how it compared, because one of the things that has come up is, well, how are other countries enabling internationally educated nurses and midwives to move there, and where is the UK kind of falling behind in terms of some of the barriers that we're putting up. In terms of healthcare support workers, Raluca, remind me again about what we've done with that group.
So we know, especially in social care, we know that some internationally educated nurses work still in care support roles, although they have an NMC PIN. And so what we've decided is to gather that information. So there will be a question as to whether you've got your PIN, which is is one of the groups. So you have got your NMC PIN. And then there is a question as to whether you're working into a registered nursing role. And if you're not, there's a variety of different other questions to really understand your experience. And again, this is thanks to Najahan, who's very driven to really understand this community of nurses that are somehow left behind, or there are barriers that perhaps we're not talking about as much as we should. And I've seen, Kerry, you've put in the chat the Sharing Best Practice in Pastoral Care 2025, which is the conference coming on the 18th of November. And thank you for the invite. We'll be talking on the preceptorship part and also mentioning this work there. So please do check that out. There was another question that was sent before, and that's a really interesting one, because often we sort of start with that. What are the measures of success for this programme? So, Lisa, do you want to reflect first, or would you like me to?
Yeah, I really love that question. So thank you for the person who submitted it. I think that for me, one of the things that I want to do is I want this work to be really practical. So I want the recommendations to, I don't want a report that says, oh, employers must prioritize retaining their IENMs. We think that most employers recognize that they need to retain their talent. So I want it to be really, really practical. So what are the levers that we can actually push and get things done? So that's why we suspect that there will be a series of recommendations aimed at the NMC. There will be a series of recommendations aimed at individual employers, and then there will be a lot of best practice that is shared as well. So that's what a kind of success looks like to me, is that we are able to actually bring people together, reach and generate novel evidence, and also able to generate recommendations that somebody within an organization can pick up and actually implement.
And that's true, and that's what I love working on projects. It's about that solution focus lens, which I find very useful at the end of a project. So I would echo your reflections as well. There's a question about HCA supposed to be registered with the RCN. I wouldn't have the answer to that. I think what we were talking about is those who work in care support roles in social care that have got an NMC PIN. And we know that there is a number in the community of those who exist. So I won't be able to speak to the registration for HCAs, unfortunately. Brilliant. If there are no more questions at the moment, I will share my screen again to talk about the next steps. But if you come up with any questions or you think of anything new, please do add it in the chat. We'll have a few more minutes at the end of it. So I'm going to try and share my screen again with you, which is the first challenge. And making big is the second one. Right. In terms of next steps, we talked to you about the variety of tools that we're going to be using. So we're going to be setting some roundtables, some interviews throughout winter and probably into the next year. When we get the results, so the survey is a reminder, will close on the 28th of November, we'll start that analysis. But all of the analysis that we do is also in conjunction with the further data and information that we have. And we are looking to launch this report in the spring of 2026. I call that about April time. I hope that's still spring in everyone's diaries. It really depends with the weather now, but around that time is when we're looking to launch it. But you'll definitely know about that. We'll be using social media and our newsletters to keep you informed. In terms of how you can get involved, and that was another question, how do I get involved in this? There are a variety of ways. Please do. We'll really appreciate if you take the time to complete the survey, but also to disseminate the survey. And it's very heartwarming to see within the chat the connections and the suggestions for those disseminations and also further connections. You have got the link in the chat, it will be sent to you over the email, and you've got the QR code there. Please do submit that case study. Again, it's not about the granular detail at this point, it's about the sort of an overview of what you do within your organization. So do try and look at that form. Drop me an email if you have got any questions about that one. Next webinar we're going to have on 27th of November between 11 and 12, and we'll be talking about artificial intelligence, which is obviously a really great significant subject, and we hope you'll enjoy the lens that we're going to be taking with that. And I think also really importantly is the FNF updates and newsletter. A lot of the information about the work that we do, sometimes ways of getting involved in terms of joining an advisory group or having further conversations. Often they go through this newsletter, so it is a monthly newsletter that comes out to all of our member organisations and also yourselves, obviously, if you work in a member organisation, if you are an alumni or if you're a scholar. So do follow the link to sign up for the FNF newsletter if you haven't done that already. If you've got any questions, again, do please reach out. Any questions? The email address is the policy email address.
Hi, Raluca, we've got some additional questions in the chat while we still have about 10 minutes. So we had one from Jess. Hi, Jess, who's doesn't surprise me to hear her bring this up. So will there be a line in this work around the needs of support to retain and develop our international students or newly registered nurses who have trained in the UK but have been born overseas? So I guess the short answer to that is no, they are not. They are excluded from our definition of IENM because they trained here in the UK. But we do have a section in the survey for people who identify as being a member of a diaspora community, because we do know that the two communities are often intertwined. And part of this is about talking about how we learn from our international workforce. So there would be a section for them if they so identify as being a member of that group, but it is there isn't one specifically around people who have moved here and then have actually qualified here.
Thank you, and thank you very much, Jess, for joining us.
And we've had some other comments in the chat as well. So Juliet wants to know, will this be emailed out when we're launching the report? Yes, we will email it out, Juliet.
The report, absolutely.
Yes.
Absolutely. You're also going to receive an email from us with the slides and also a link to how you can watch the recording and further other information within that email. So you will be kept informed by us, but definitely when the report comes out, you'll definitely hear about that.
And Nurjahan has provided some clarity. That's what I thought was the case, Nurjahan, but I was afraid to say something wrong. So thank you for clarifying that. And then we've got a really kind of lovely comment from Randy. Hi, Randy. It's really nice that you're here. The expectation versus reality that IENs experience, which contributes to leaving rates, will be a good aspect to explore. I suggest that the interview be conducted in the primary language of the IENs to explore better, not just the ideas and thoughts, but the actual feelings embedded in the experience. It will be interesting to connect with the source countries of IENs. Yeah, absolutely. And that's what part of our third section around global partnerships is about making those connections with some of those source countries and saying that it is really, really important that we still do that in the NHS. We know that there is a lot of change happening and there's a lot of reorganization going on, but we think it is still really important that those global partnership teams exist and that they do that work. In terms of conducting interviews in the primary language of the IEN, I can't promise that we would be able to do that, but I completely take your point. And I think there is some literature actually that we came across that did explore some of that. So we will certainly look in to see if we can draw on any of those insights. And Liz has asked, will there be a survey question on how the IENM self-identify? The IEN label has been a point of discussion. That's a really good question, Liz. There isn't a way for them to sort of self-identify as such. We ask people which of these categories do you belong to, and then we define how we've identified IENMs. But I do take your point. This has been a point of discussion within the foundation as well. So we hope that our definition is clear in terms of how we phrased it about kind of qualifying outside of the UK rather than being kind of educated, because we know that point can sometimes draw some objections in terms of the way that different pathways to qualification exist outside of the UK. But I very much love to hear, how has it been a point of discussion within your organization?
Brilliant. And I think we sort of answered most of the questions, or hopefully all of the questions within the chat. I was just writing the email address again. If you have got any other questions, or you want to connect, or if there's anything that you think we should really know, for example, from an environmental scan, is there a report that perhaps we didn't know, it's something we should really take account of, please always drop us an email. And I think with that, we're probably going to give you 5 minutes to have a coffee before your next meeting. So thank you so very much for attending and for joining us today. Thank you.
Thank you all. Thank you.
Luca, we have an evaluation survey here.
Yes, sorry. Yes, of course, and I forgot about that. There's also an evaluation survey, so thank you, Paul. We'll add it into the chat. So this is an evaluation of this webinar session, and again, we'll be sending you an email with that link as well.